Another question, why is MS still referred to as a Caucasian disease? There are many African Americans and Asians with MS. Absolutely the case. This is outrageous that it is still thought of as a problem that only affects Caucasians. After being on Tysabri, what is recommended?
The risk of the PML is greater after 2 or 3 years, so you need to talk to your doctor, maybe have a blood test that could tell whether you're at risk for the disease, and consider coming off it or staying on it with careful monitoring.
When I have pain that comes from heating up during exercise, will this make my MS worse?
It will not make your MS worse, you just need to cool down.
What studies have been conducted that teach us about people who have MS by the MRI that have no symptoms?
MS can be silent, and you can see it on the MRI. If it comes up for any reason because you had an MRI, you need to be followed very carefully with repeat MRIs, but you don't need treatment.
What about pregnancy and MS?
People who are pregnant do better when they have the MS. People who have MS do better during pregnancy. There may be increased risk of relapse after the baby is born, so you need to be watched carefully.
My son lost sight in one eye at age 30. What is the predictable path?
If he lost sight at age 30 and the MRI doesn't show anything, he may not have further problems. If the MRI shows lesions in the brain or spinal cord, he's very likely to develop MS.
My daughter just developed relapsing remitting MS at age 21. Will she stay at this stage or progress?
The good chances are that she'll stay at this stage, especially if she gets treatment. We know that if you get treatment early, it can prevent the progression.
Is a pill therapy possible?
There are 5 pills currently in phase 3 trials, so I would predict within the next 2 or 3 years we'll have pills for MS.
What are the latest treatments for Neuromyelitis Optica, NMO?
This is a form of demyelinating disease that's different from MS. Current treatments include steroids, oral immunosuppressants like Imuran and Cellcept, and some people take Rituxan.
Can I get the blood test for MS?
There is no, in quotes, blood test that you can get somewhere, but if you go to one of the research centers, they might take some blood, and your blood can be studied.
What is the first clinical or laboratory sign of MS?
The first clinical sign is usually a symptom, loss of vision, numbness, trouble walking. The first laboratory sign is usually an abnormality in the MRI.
How can I avoid another attack?
The best way to avoid another attack is to take one of the medications for MS, eat healthy, watch your lifestyle, and probably take vitamin D.
I have 5 people with MS in my family. Is there a genetic cause of MS in this family?
There are some families where there's a lot of MS, and this is then related to genes in the family. We don't know exactly which genes, but certainly we know that there's these multiplex families, and everybody should be followed carefully.
And the last question from the Wall Street Journal, I read that sunlight is related to MS. Is there a greater number of MS patients in the Northern Hemisphere?
The answer is yes. The farther you are away from the equator, the more likely you are to get MS. It relates to sunlight, but even if you move to Florida and Texas, MS is still common there. So it's complicated, but sunlight can play a role.
Thank you.
I want to thank everybody for being here today. I really appreciate it. I want to thank this stellar panel of doctors. Thank you for your presentation. MS patients and advocates too, who answered a lot of questions people understand. Again, we're doing a campaign for the month of May. Orange, you happy to raise MS? I see lots of people are wearing orange today, so I'm so excited. Thank you for your continued contributions and caring, and we hope that we will do amazing research this year, and it would be great if we didn't have to be back here again. So we're aiming towards that goal in the near future. Thank you, everyone.